you are a doctor. You wanted to be a doctor your whole life and went through the process of the education and the training and certification and all of that. But then you stepped away from practice. What changed for you about medicine and the practice?
Yeah, I have 4 children at home, so I'm trying to figure out what age it was that I wanted to first be a doctor. I think it was probably around 7 or 8, given that my 4-year-old wants to be a leopard. Um, I I got into medicine, and to be honest, my first patient on my 3rd year rotations in internal medicine, rotations where you're basically getting to experience what it's like to be an internal medicine doctor or a surgeon or a psychiatrist or emergency room physician. And the first patient on the wards was 28, on the south side of Chicago and dying of complications of end stage AIDS, HIV. And I'm not old enough for that to have been the reality that he should have been living. There were drugs available, there were therapeutics, and to actually help manage that condition and that disease, he should have had a much longer life. And I began to ask the question of where are we failing Marcus? Like where did we go wrong that we can't have fixed this problem? And that overwhelmed me, that question, to the point where everything I loved about medicine and what I thought was beautiful about the idea of serving others, which I still have as a motivating factor of my DNA, was complicated in that kind of rush of what the reality of the medical system was at that moment. And I think I began searching for what the right path was, and how to think about best influencing and tackling the challenges so that we could avoid that issue and that we could also just deliver a better healthcare experience and system for all of us.